Anti-psychotics. You've heard this term, but do you really know what they are? Below is a typical explanation, but it goes far beyond a simple statement. The class of psychiatric medications primarily used to manage psychosis, in particular schizophrenia and bipolar, and increasingly being used in management of psychotic disorders. Antipsychotics, there's typical and atypical. Now, before we get into that, antipsychotics are used from everything from helping people sleep to treating depression to treating anxiety. It's really a broad spectrum. Let's continue. Sapphirus. Tardive dyskinesia describes a group of persistent permanent disorders caused by antipsychotics. Okay, so tardive dyskinesia, I'm going to show you a famous picture of somebody who has tardive dyskinesia, and you're not going to like what you see. The first antipsychotics that came out were Thorazine and Haldol. Haldol is still widely used, even though it can cause tardive dyskinesia in greater proportions than Thorazine. But we're also going to talk about some drug companies. A week ago or so, I gave a talk to about 120 senior citizens. Let's see. The crowd was largely receptive to the topic, how American consumers have been routinely misled about the safety and effectiveness of new drugs and treatments. They asked intelligent questions, and one retired psychiatrist even stood up to say how much he regretted having taken money from a drug company in the form of a free junket to a tropical local to hear speeches about how wonderful its SSRI antidepressant was. He wouldn't do that now, he said, and he was sorry he had done that. So these drug reps come to the office and they say, Sapphirus is good. Sapphirus actually recently is a new drug on the market, but I find it interesting that drug companies are targeting the youth of America. Sapphirus is approved for adolescents, and the fact of the matter is, psychiatry usually schizophrenia and bipolar usually develop around the age of 13 to 16. It's usually in the younger years, but I also want to point out that schizophrenia is the lowest, has very low rates in America. True schizophrenics are just not prevalent in society compared to bipolar disorder. But it's used for bipolar disorder as well. And I remember talking to one MD, and he said something that pretty much summed up everything. And that is that bipolar people are the bread and butter of society, of psychiatry. And what that means is there are so many bipolar people that it's just uncanny. Does Sapphirus really work? It has so many side effects, I'm not going to even begin to list them, because you got to understand all these antipsychotics have side effects, okay? And if you look at antidepressants, a long list of side effects. They're not typical usually, but they do happen. Some have a higher chance than others. But if I were you, what I'd fear is tardive dyskinesia. And you're going to see a picture of that in a second. I want to point out Zyprexa. Since about, I think, 2004, Zyprexa has been releasing information that doesn't make it look too good. We'll go on. I think there's more on this. Wednesday, July 1st, 2015, a growing number of teens and young adults are being prescribed powerful antipsychotics, even though the medications aren't approved to treat two disorders, ADHD and depression. They are commonly used for, a new study shows. Researchers found that antipsychotics use rose among children aged 13 and older from 1.1% in 2006 to nearly 1.2% to 2010. Among young adults, people aged 19 to 24, antipsychotics use increased from 0.69% in 2006 to 0.84% in 2010. Of concern to some experts are the conditions of which many of these antipsychotic prescriptions are being written, namely attention deficit hyperactivity disorder and depression. Currently, the U.S. Food and Drug Administration approves this class of drugs for psychiatric conditions such as psychosis, bipolar, schizophrenia, or impulsive aggression tied to. So, what we have here is doctors prescribing antipsychotics for the wrong reason. And I think that the pharmaceutical companies have a lot, they do have a lot to do with this. The total worldwide market for antipsychotic drug use is expected to reach $19.6 billion in 2010. With continued market penetration into new diseases and prices increases for currently marketed antipsychotics, this market is expected to grow to a high $20.8 billion in 2011 and then hit a low of $14.4 billion in 2013 before resuming growth again to $14.8 billion in worldwide sales in 2014. This represents the total compound annual growth rate. So they're making a fortune off of antipsychotics. $20.8 billion in 2011. That's more than the government. I don't want to say that, but the government does not spend that type of money to help people, and drug companies are profiting left and right. First generation typical and second generation atypical. Typical antipsychotics are the older ones, like I mentioned, Thorazine and Haldol. Atypical, you can consider Zyprexa an atypical antipsychotic. Generally, they have less side effects, but altogether, schizophrenics are partially helped by these drugs. The fact of the matter is they don't know really how they work. They have guesses, but they do not know precisely how they work. Sapphires, they really are not sure how it works. The drug companies mimic similar combinations of other drugs, and they come out with something that they think will work, and they test it on the public, and they're successful. Now, this is tardive dyskinesia. This is a famous picture. This is what happens when people are given high dosages of Haldol, for example, other antipsychotics. It causes tardive dyskinesia. This person is not sticking their tongue out on purpose. Their eye is not on. Notice the eye, it moves. It distorts your face. It's a very sad disease. 1 in 6 patients who take Zyprexa will gain more than 33 pounds after 2 years of use, as the label says. So right now, Zyprexa is currently, let's see. They thought it causes high blood pressure, not high blood pressure, high cholesterol. It causes numerous amount of things. Weight gain, diabetes. Any sane psychiatrist will not use Zyprexa for long-term benefits unless it's the last cause. Okay, so there are other antipsychotics out there. For example, Seroquel. Seroquel is prescribed in large dosages. I know for a fact that most people prefer Seroquel. In fact, I'll give you a little piece of information. In jail, Seroquel is sold, traded, and it is considered a drug that people want to get their hands on. But the fact of the matter is, antipsychotics are being treated for everything under the sun, and that needs to stop, because they're not approved for anxiety, ADHD, or depression. Some psychiatrists think and believe that they help. Whether they do or not, I'd like to see some studies. Thank you, good night, good day, good mental health.